Mt Hagen General Hospital is in dire need of financial assistance to operate. This has left low shortage of medical drugs and other consumables. The hospital pharmacy is also closed and outpatients have been forced to buy medicines at other pharmacy outlets. Children's outpatient is closed, while the emergency department is seeing emergency cases only and all elective surgeries are put on hold. Consultation clinic, eye and dental clinics are closed. Patients at each ward have been discharged, while those with serious illnesses that need the nurses' and doctors' care remain. However, the HIV and TB clinics will remain open at this time.
At a local level, we're spending nearly 6,000 kina per day, 7 days a week, 365 days of the year, to make good the shortage that comes out of the central system. And I'm here to assure you that if my doctors and nurses didn't have drugs, they'd be pounding on my office door, because as some of your viewers would realise, in 2015, 2016, when we did have a shortage of drugs in the hospital and in the system, in our provincial system generally, the clinicians got very, very angry. And we've never had that situation again since.
The hospital has exhausted its operational budget collected at the revenue area. This has forced them to also send their short-term contract workers home. WHPHA Senior Executive Management made this decision in light of the drastic cuts of 6.5 million kina from the authority's budget of this year affecting the PHA. WHPHA had received 50% of its budgeted funds for January and 35% for February. The PHA said it was not enough to cover all expenses such as the purchasing of drugs and medical consumables, food for patients, fuel for the fleets and standby generator.
It is completely unrealistic to think that you can take 76 million out of the operational budget of 21 PHAs and expect them to continue to provide the same level of service.
Over the past weeks, the hospital was unable to transport patients using the ambulance. And with COVID-19 on the rise in the province, isolation beds are limited and the hospital is expected to see the centre overcrowded. Patients with underlying health conditions have told EMTV News off camera that they are scared to go home and will stay at the hospital until the hospital reopens. Vasanata Yama, National EMTV News, Mt Hagen.